Our today's topic is the ureter. So we'll discuss about the course of ureter and its termination and arterial supply of the ureter. So these are the main uh, important SCQ question in the university exam. So let's start it right away. So first we'll discuss about its origin, how the ureter is formed. So ureter is formed as a continuation of the renal pelvis in the kidney. The ureter then runs inferiorly from the apex of the renal pelvis. Renal pelvis is somewhere inside the kidney, and it runs at the apex of the from the apex of the renal pelvis. Then it descends inferiorly on the surface of a vas major muscle. Here you can see posteriorly this is vas major muscle. It runs under these gonadal vessels and it reaches the common point at which the common iliac artery bifurcates. So it passes above the bifurcation of the common iliac artery. It then enters the pelvic cavity by crossing the pelvic brim. So we know that pelvic brim is a bony margin which lets the abdominal cavity into the pelvic cavity. Let me show you a diagram of pelvic brim. Here you can see this is the this bony margin is the pelvic brim. Above this is the abdominal cavity, or we call it as false pelvis, and below this pelvic brim is the true pelvis. So the ureter crosses this pelvic brim and then it runs along the anterior margin. So suppose this is the ureter coming. The cursor of the mouse represents the ureter. So the ureter, as it crosses the uh, pelvic brim, it runs along the anterior border of the greater sciatic foramen. Here you can see that this is the greater sciatic notch. After the ligaments bound it will be converted into greater sciatic foramen. So it runs along the anterior margin of greater sciatic notch and then it drains into the gallbladder. So the way it actually drains in the gallbladder is through an oblique passageway. So we missed an important point about ureter. Let before before it drains into the gallbladder, it has an important relation with the uterine artery. So here you can see that this is the pelvic cavity. We have we are now seeing it from the upward direction after we transversely cut it at the level of, I suppose, ilial bone. So we see that this is the common iliac artery and it gives the branch common iliac, but this is the internal iliac vessels, and this is internal iliac artery, that is a branch of common iliac artery. So a branch from a internal iliac artery known as uterine artery supplies blood to the uterus. So the ureter runs, this is the ureter. So the ureter runs under this uterine artery. Remember, this is a very important course. This is a very important point to remember, that ureter runs under the uterine artery and then it drains into urinary bladder. The way it drains into urinary bladder is through an oblique passageway to the muscular wall of the urinary bladder. Let me show you the picture. So here you can see that this is a ureter. Here ureter entered the wall of muscular wall of urinary bladder. This is the lumen of urinary bladder. So inside the muscular wall, as the ureter and runs in its muscular wall, it forms a oblique passage, As you can see in this picture, this is the oblique passage of the urinary bladder. This is the passage when our gallbladder is not filled enough with the urine, and this is the picture when the gallbladder is filled enough with the urine, that it pushes or applies the force on the inside of the urinary bladder, that results in the increase in angle between this urinary bladder, this arch of urinary bladder. As a result, you can see that the urine will not move from the ureter backward, so it forms a flappy valve that prevents the backflow of the urine in the ureter. So remember that this is the importance of the oblique passageway of the ureter through muscular wall of urinary bladder. Now it trains. We have discussed about the origin, course, and termination of the urinary bladder. Now let us discuss about the constrictions of urinary bladder, the points where the urinary bladder is constricted throughout its course. There are 3 or 4 points. First point is the pelvic ureteric junction. At this point, the ureter is little bit constricted. This is the point where the ureter leaves the kidney, just after it leaves the kidney. It's called pelvic ureteric junction. The second point where the ureter is constricted bit is by as it crosses the pelvic brim. We know that there is a bony margin, so there is a point where there is a small constriction in the ureter. Then the third point is the as it crosses the ductus deferens in males, and the third point, as I discussed earlier, is its course through the urinary bladder, and the fourth is the point where it opens into the urinary bladder. So these are the 4 or 5 points that you should know where the urinary bladder is constricted or can be constricted in any abnormal conditions. In this diagram, these are the normal constriction side, where the urinary bladder is little bit in touch with these structures, and there are chances of constriction whenever there is any abnormality. So these were the constrictions of urinary bladder. The last thing that is left is the blood supply to the urinary bladder. So now let us discuss about the blood supply. For the blood supply, we divide the ureter into 3 parts: proximal part, middle part, and the descending distal part. The blood supply to the proximal part of the ureter is derived from the ureteric branch from the renal artery. As you can see that this is the renal artery, and this small branch is the ureteric branch of from the renal artery that supplies the proximal part of the urinary bladder. The middle third of the urinary bladder is supplied from the branch from the abdominal aorta. As you can see, this is the branch that is coming from directly from the abdominal aorta and supplying the middle third of the urinary bladder, while the distal part of the urinary bladder is supplied by the uterine inferior vesical artery and ureteric branch. Inferior vesical artery, these two, and ureteric branches, both these arteries are branches of the internal iliac artery. So let us summarize the blood supply. Superior third is supplied by the ureteric branch from the renal artery. Middle third is supplied by directly a branch from the abdominal aorta, and the distal part is supplied by the inferior vesical artery and ureteric branch of internal. Uh, Both these are the branches from the internal iliac artery. So this was all about the ureter.